Well, here at Fox 6, in addition to traffic, I also cover sports. So today I'm talking with one of the top orthopedic surgeons in the nation, Dr. Jeffrey R. Dugas. Now, Dr. Dugas, you work here with Andrews Sports Medicine. You also work with American Sports Medicine Institute, researching safety, and then in your spare time, I guess, what little you have, you also are the medical director for USA Cheer. But thank you for joining us this morning.
Thanks, Britton. Thanks for having me. I appreciate it.
Now, I recently visited you in the biomechanical lab down in St. Vincent's to learn about what you're doing with ASMI and researching safety, specifically in ACLs. But before we talk about that visit, why is it that more recently we've learned about ACL injuries being more common in female athletes than male athletes?
That's right, Britton. It's about a 2-to-1 ratio, women to men, ACL tears across the country in athletes, and it has to do with several factors. Some anatomic, some less anatomic. They have a little bit more of a knock-kneed angle in their knees, and this is a generalization for women. Not every woman is like this, but a little bit more flexibility in their feet, a little bit more flexibility in their hips and knees, which can lead to a little bit of a higher risk of injury as they come down from a jump or a land or twist or turn type of mechanism.
But you guys over at ASMI, y'all are working to prevent these injuries. What exactly are y'all doing?
Well, obviously we're trying to learn more about injuries in athletes of all types, women especially, and ACL tears. In particular in the cheerleading world, cheerleading is actually one of the safer sports at the high school level, among the last in injury rates. But there are some things that make them a little more prone to injury, as opposed to, some sports that have equipment that are relatively protective against injuries. Cheerleaders have very little equipment, and this is a standard fair cheerleading shoe. This is actually the top of the line shoe, a varsity shoe. These shoes are designed to be held, so they're very flexible, they're very lightweight. Most shoes you can't do these kind of things with, but these are designed to be held for the various stunts that they do. But if you were to look inside the shoe, what you'd see is there's very little support, and arch support, which can lead to a position on the floor as they land where their feet pronate, which can increase the angle at their knees and therefore increase the risk of injury to the ACL. So along with a company called Topical Gear, we developed an orthotic, which is just a simple piece of plastic, but they're specifically manufactured to go into these shoes. So these shoes are very light and narrow. A standard off-the-shelf orthotic would not fit in these shoes. So these orthotics are manufactured specifically for these shoes, and they're designed to fit nicely in there without altering the function of the shoe, which can still be held in a base position, and this can then provide support to the foot and keep the angle at the knees, as you can see in the video, from being bad for the ACL. And
then I know you mentioned that cheerleading is one of the safer sports, so the research at ASMI is just going to make it even safer. Real quickly, before I let you go, can anyone go and buy these orthotics?
Anyone can buy them. Topical Gear has them on their website. I believe at Andrews Sports Medicine we have them also, but anybody can buy them from the Topical Gear website. They're not expensive. I think they're somewhere around $20. I may be wrong about that, but they're relatively inexpensive.
Well, great. And if you want to learn more about these ACL injuries and what ASMI is doing to prevent them, we've got a full story coming on tonight at 10 p.m. We take you inside of that biomechanical lab. You can watch that tonight.